Welcome, cat owners. Today we delve into understanding your cat's health through the subtle and sometimes not so subtle signs they may show when unwell. Our feline friends can't directly tell us when they're feeling under the weather, so it's up to us to decipher the clues they leave us. We're going to explore 10 key signs your cat might be sick, from changes in appetite and grooming behavior, to more noticeable symptoms like vomiting or respiratory issues. These signs are not always cause for alarm, but knowing what to look out for can be the first step in getting your cat the help they need. Our aim is to empower you with the knowledge to recognize these signs early on. Because the sooner an issue is detected, the better the chances for a quick recovery and a return to normal, happy cat life. It's crucial for every cat owner to recognize these signs early to provide the best possible care. Let's begin with appetite. Cats are generally consistent with their eating habits, so any sudden change is noteworthy. Just like us humans, our feline friends can have off days where they eat less than usual, or perhaps indulge a bit more. But when these changes persist, it's time to pay attention. A decrease in appetite could be a sign of several health issues. It might be as simple as a dental problem making it painful for your cat to eat, or it could be a gastrointestinal issue, such as an upset stomach or blockage. Stress can also cause your cat to eat less, and stress in cats can be triggered by changes in their environment, like moving to a new house or introducing a new pet. On the flip side, an increase in appetite should also be watched closely. If your cat is eating more than usual and still seems hungry, it could be a symptom of a more serious condition. For instance, diabetes can cause an increase in hunger, as can hypothyroidism, a common ailment in older cats. The key is to know your cat's normal eating habits so you can spot any significant changes. Regular feeding times and measured portions can help monitor intake. And remember, while these symptoms can indicate a problem, they're not definitive diagnoses. If you notice a persistent change, it's always best to consult your vet. A decrease might suggest dental issues, gastrointestinal problems, or even stress. Conversely, an increase might be due to conditions like diabetes or hypothyroidism. Weight fluctuations can be alarming. It's like a silent alarm bell ringing, alerting us that something might be amiss with our feline friends. A sudden drop in weight, even if your cat has been on the plumper side, is not a cause for celebration. Instead, it should serve as a prompt to dig deeper. This unexpected weight loss could be due to a variety of reasons. It might be a sign of malnutrition, perhaps your cat isn't absorbing nutrients from its food properly. Or it could be a symptom of parasites silently leeching off your cat's health. Even more seriously, it could be an indication of organ failure. On the flip side, an unexpected increase in weight is equally concerning. Sure, a chubby cat might seem cute, but it's not healthy. Weight gain can lead to obesity-related health issues such as diabetes or joint problems. So how do we keep tabs on our cat's weight? Regular weigh-ins are the answer. Just like us humans, cats too should have routine weight checks. You don't need any fancy gadgets. A simple home scale would suffice. The trick is to first weigh yourself, then pick up your cat and weigh again. The difference gives you your cat's weight. Remember, any significant change in weight, be it loss or gain, warrants a visit to the vet. Weight loss, even in an obese cat, should never be ignored. It could be a sign of malnutrition, parasites, or organ failure. Weight gain, similarly, can lead to obesity-related health issues. A lethargic cat might be more than just lazy. It's normal for cats to enjoy their rest, but there's a difference between a cat that's simply enjoying a snooze and one that's lethargic. Let's delve into this a bit deeper. Cats are known for their love of sleep, with adults sleeping anywhere from 13 to 14 hours a day, and kittens or older cats sleeping even more. However, each cat is unique, and you, as the caretaker, know your feline friend's routine best. If you notice a significant increase in sleep or a decrease in activity, it might be worth paying attention to. Lethargy can manifest in many ways. It might be your cat sleeping more than usual, or they might seem less interested in playtime, even when you break out their favorite toy. Perhaps they're not rushing to the window to watch the birds like they used to, or they're less enthusiastic about meal times. These changes can be subtle, and it's easy to dismiss them as your cat just having a lazy day. But remember, cats are masters at hiding their discomfort, and lethargy is often one of the first signs something is amiss. Lethargy could indicate a wide range of health issues, from minor infections to more serious conditions like heart disease or anemia. It's important not to diagnose your cat at home, though. If you notice prolonged lethargy, it's time to consult your vet. They can provide a thorough examination and guide you on the next steps to take. If your cat is spending more time napping and less time playing, it could be a sign of illness. Occasional vomiting isn't uncommon, but when should you worry? Just like us, our feline friends might feel a bit queasy now and then. However, there's a difference between a hairball cough-up and serious vomiting. Let's break it down. Firstly, hairballs. They're a part of a cat's life, especially if your feline is long-haired or an avid groomer. Hairballs are usually cylindrical due to their journey up the narrow esophagus and often accompanied by a small amount of yellow or white froth. On the other hand, vomiting food, especially soon after eating, could be a sign of health issues. Some cats eat too quickly and then throw up their meal almost immediately. This might not be a serious problem, but it's worth monitoring, especially if it happens frequently. Then we have the more serious types of vomiting. If the vomit is bloody, dark like coffee grounds, or accompanied by other signs such as lethargy, diarrhea, or loss of appetite, it's time to call the vet. These symptoms could indicate conditions such as pancreatitis, kidney failure, or gastrointestinal blockages. Lastly, frequent vomiting, even if it's just bile or water, can lead to dehydration, which in itself can become a serious problem. If your cat is throwing up more than once a week, it's worth seeking professional advice. So, while an occasional upchuck might not be a cause for alarm, it's crucial to monitor your cat's vomiting patterns. Frequent or bloody vomit can be a serious concern. Next, we examined bathroom habits. You may not realize it, but your cat's litter box is like a health report card. Any changes in what you find there can be a sign of underlying health issues. Let's start with diarrhea. Frequent, loose or watery stools can be a sign of many things, including dietary indiscretions, intestinal parasites, or more serious issues like inflammatory bowel disease or certain types of cancer. If it persists for more than a day or two, or if it's accompanied by other signs of illness such as vomiting or loss of appetite, it's time to call the vet. On the other hand, constipation or infrequent bowel movements can also be a concern. It might simply indicate a need for more fiber in the diet, but it can also be a sign of dehydration, a blockage, or a neurological problem. Changes in urine are another thing to watch out for. Increased frequency of urination can be an early sign of kidney disease or diabetes. Blood in the urine, difficulty urinating, or urinating outside the litter box can indicate a urinary tract infection or urinary stones, both of which require immediate veterinary attention. In summary, keeping a watchful eye on your cat's litter box habits can provide invaluable clues about their health. Changes in the litter box, whether diarrhea, constipation, or changes in urine, can indicate health issues like kidney disease or urinary tract infections. A cat that stops grooming or grooms excessively might be signaling a problem. It's no secret that our feline friends take pride in their appearance. Their meticulous grooming routine is not just about looking good, it's an integral part of their overall health. When a cat's grooming behavior shifts, it's often a telltale sign that something is amiss. Overgrooming, for example, can manifest as bald patches or irritated skin. This can be a response to itchy skin conditions, parasites, or even stress. On the flip side, a cat that neglects grooming might be suffering from an underlying health issue. A lustrous coat can quickly become dull and matted if a cat is feeling unwell. Poor grooming can be a sign of dental pain, making it uncomfortable for the cat to clean itself. It could also be indicative of arthritis, making it physically challenging for the cat to reach all areas of its body. More alarmingly, a lack of grooming can be a symptom of severe illnesses such as kidney disease or diabetes. So keep an eye on your cat's grooming habits. If you notice drastic changes, it's important to seek veterinary advice. Remember, early detection can make all the difference in your cat's treatment and recovery. Over-grooming can be due to skin problems or stress, while poor grooming might indicate a more severe issue. Respiratory problems can range from simple colds to serious infections. Just like us, cats can develop a range of respiratory symptoms. They might sneeze, have a runny nose, or show signs of discomfort like pawing at their face or avoiding food due to difficulty in swallowing. Let's dive a bit deeper. Sneezing or a runny nose can often be the first signs of an upper respiratory infection. This can be caused by a variety of viruses or bacteria, and it's especially common in kittens or cats that have recently been in a shelter or other crowded environment. Next, we have coughing. A cat's cough can be a dry, hacking sound, like they're trying to clear their throat, or it can be a wetter sound, like they're trying to bring something up. Either way, coughing is not normal in cats, and it's usually a sign of an underlying problem that needs to be addressed. Wheezing and labored breathing, on the other hand, are usually signs of lower respiratory issues. This could be something like asthma, or it could be a sign of a more serious issue, like heart disease. In all these cases, it's essential to seek veterinary advice. Even if it's just a simple cold, your cat will be feeling miserable and will benefit from some supportive care. If it's something more serious, early treatment can make a huge difference. Persistent coughing, wheezing, or labored breathing are signs that your cat needs immediate veterinary attention. Eye or nose discharge can often be overlooked, but it's important that we pay attention to these signs as they can indicate potential health problems in our feline friends. Discharge from your cat's eyes or nose could be due to a variety of reasons. It could be something as simple as an allergic reaction or as serious as an upper respiratory infection. Clear discharge is often associated with allergies or physical irritants like dust, while a thicker yellow or green discharge might signal an infection. Another indicator to look out for is excessive tearing or watery eyes. This could be a sign of conjunctivitis, a common eye condition in cats. On the other hand, a dry nose might just mean your cat is a little dehydrated, but if it's coupled with other signs of illness, it's best to consult a vet. Now, it's not enough to just spot these signs. Knowing how to safely clean your cat's face is equally important. Always use a soft, damp cloth or a pet-safe wipe. Be gentle and avoid rubbing, as this can cause discomfort or even injury. And never use human products unless specifically recommended by a vet. Remember, it's always better to err on the side of caution. If you notice any changes in your cat's eye or nose discharge, it's best to consult your vet. We'll explain what different types of discharge could mean and how to safely clean your cat's face. Behavior changes can be subtle. Often these changes are the first indication that something might be amiss with your cat's health. Cats are known for their independent and sometimes aloof nature, but they are also creatures of habit. Any deviation from their normal behavior can be a telltale sign of an underlying health issue. For instance, if your usually sociable cat suddenly starts hiding more or becomes less interactive, it could be a sign of discomfort or pain. Cats instinctively hide their pain as a survival mechanism, so it's important to be observant of any changes in their usual behavior. Another sign could be a cat that suddenly resists being touched or groomed. If your cat, who usually enjoys a good cuddle or brush, starts to avoid these interactions, it may be because they are experiencing pain or discomfort. Also, pay attention to any changes in your cat's mood. A usually playful cat becoming lethargic or an ordinarily calm cat showing signs of aggression could be indicative of a health problem. Changes in mood can also be a sign of stress, which can exacerbate existing health issues or even cause new ones. Remember, you know your cat best. If you notice any changes in their behavior or mood, it's always a good idea to consult with a veterinarian. A cat in pain might hide more, avoid being touched, or even become aggressive. Understanding these behavioral cues is vital for early intervention. Finally, listen to your cat's voice. Cats like us use their voices to communicate. A change in their vocalization can be a signal that something is amiss. The key here is to be familiar with your cat's normal vocal patterns. Some cats are naturally more vocal than others, and that's perfectly normal. But if your usually chatty feline friend suddenly becomes silent, or if your ordinarily quiet cat starts meowing more frequently, it may be time to pay attention. A cat's meow can signify many things, from hunger to attention-seeking, from fear to pain. When a cat is in distress, their meow might sound more urgent, louder, or even more high-pitched than usual. On the other hand, a cat in pain might become less vocal, or their meow might sound weaker or more strained. Take note of the frequency of the meowing as well. An increase in meowing, especially at odd hours, could be a sign of cognitive dysfunction in older cats, akin to dementia in humans. It could also be a sign of a medical condition causing discomfort or pain. In contrast, a decrease in meowing could indicate that your cat is feeling unwell or is in pain. It could also be a sign of stress or anxiety. Always remember, any significant change in your cat's vocalization warrants a visit to the vet. Changes in how your cat meows, whether it's more frequent, sounds painful, or they're meowing less, can all be signs of distress or illness. Understanding these 10 signs will empower you to better care for your cat. By staying alert and observant, you can pick up on the subtle cues that your feline friend might not be feeling their best. Remember, our cats rely on us for their well-being, and it's our responsibility to ensure they're as happy and healthy as possible. Whether it's a change in appetite, unusual lethargy, or a shift in their meowing, these signs are your cat's way of communicating their health status. Don't dismiss them as just odd behaviors. They could be a cry for help. A healthy cat is a happy cat, and a happy cat makes for a cheerful home. So keep these signs in mind and stay vigilant. Always consult your veterinarian if you notice any of these symptoms. Early detection is key to maintaining your cat's health and happiness. Thank you for joining us today. Here's to a long and healthy life for your feline friends.